Soham Bera. Today I am going to tell you about contact lenses. Contact lens is an optical device designed to stay in contact with the cornea. Leonardo da Vinci was pioneered in describing optical principle of contact lens in Codex of the Eye, Manual D, published in 1508. So now the indication of contact lenses. First indication and major indication is optical. In majority of cases, contact lenses are used for optical purpose to correct refractive error. That is myopia, hypermetropia, astigmatism, anisometropia, aphakia, particularly unilateral aphakia, and presbyopia. It is also used to correct irregular astigmatism and irregular corneal surface, that is keratoconus. Now the second part of contact lens uses indication is cosmetic. The camouflages a blind eye with corneal scar with a painted contact lens, and second are to change the color of the eye for cosmetic purpose. Now the third part is therapeutic purpose, to act as soft bandage contact lens in certain situation, that is corneal perforation, bullous keratopathy, recurrent corneal erosion, etc. To prevent symblepharon in chemical burn, especially alkali burn. To prevent amblyopia in anisometropia. To focus the fundus in the trabecular meshwork during surgery or laser procedure. To prevent photophobia in patients with aniridia and albinism with a contact lens, iris is painted peripherally with a clear central optical area. To prevent diplopia and help restore binocular vision in patients with unilateral aphakia or aphakia in one eye and pseudophakia in the other eye. To treat amblyopia, to act as an occluder when conventional occlusion options are rejected by the patient. To accurately focus during laser therapy, particularly YAG laser, argon laser, diode laser, for various indications along with slit lamp. To enhance color perception in red-green who are color deficient, color blind, who have suffering from color blindness. Red-green deficient individual X-chrome corneal contact lenses and chrome gel soft contact lenses are used for this purpose. Now it can also use as a diagnostic purpose also. Various contact lenses are used along with slit lamp for diagnostic purpose, gonioscopic lens for gonioscopy, Goldman 3-mirror contact lens for gonioscopy and fundus examination, various fundus contact lenses, radio opaque contact lenses for location of intraocular foreign body. In ERG, an electrode is placed in contact lens with the cornea, often via a contact lens. And pharmacological use also is there. Earlier, special contact lenses are soaked in drugs, mainly pilocarpine, for sustained release delivery to the eye. So friends, stay safe, stay healthy. Namaste.